Hello, nice to meet you. I'm Chae-Young, um, and I would like to talk about uh, the achievement of Korea of COVID-19 and um, lesson. The country appeared on the verge of a disaster, but the government and health authorities responded with a comprehensive campaign of testing, trace, and isolation and treatment. Social distancing rules were introduced, but the country never went into a lockdown. It even went ahead with the parliamentary elections in April. South Korea turned from a global hotspot to a model of success. It didn't happen by chance. We are proud of our healthcare workers. Uh, so I'm very thank you so much. On January 10th, South Korea declared its first case of coronavirus. At the end of February, it had the largest outbreak outside of China. But South Korea is now widely considered a leading example of how to manage the crisis. Within days of that first case, the health ministry promised an all-out response to tackle the virus. And for a few weeks, the country appeared to have the situation under control. But then patient 31, a woman with a fever, attended a service of a religious sect in Daegu with about 1,000 other worshippers. That encounter led to a wave of new infections. Daegu became the epicenter of a Korea outbreak. The country appeared on the verge of a disaster. But the government and health authorities responded with a comprehensive campaign of testing, tracing, isolation, and treatment. They used the CCTV and cell phone surveillance to track down contacts of confirmed cases. Residents would be sent messages to inform them if someone living or working close by had the virus. Social distancing rules were also introduced, but the century never went into lockdown. It even went ahead with the parliamentary elections in April. Health authorities later said that there wasn't a single case of local transmission caused by people going to the polls. Despite the highest voter turnout in nearly 3 decades. At one point, the country declared no new domestic cases. But even here, there have been flare-ups. There was a new cluster linked to clubs and bars in Seoul earlier this month. The need for vigilance has gone away. South Korea turned from a global hotspot to a model of success. It didn't happen by chance. The public and public institutions have been down this road before. Dealing with the SARS, the HIV epidemic, and an outbreak of MERS. It takes lessons from those emergencies to make sure agencies have the flexibility and authority to react quickly. And it's now urging the international community to give the WHO greater powers to do the same at a global level. So I think that we must update the WHO international health regulations and other relevant norms. That is very important things, I think so. And argument that with the binding legal force, a novel infectious disease could emerge at any time. And we must be able to respond more quickly and more effectively. Thank you very much for listening my word.